You're welcome this evening, ladies, to the OET Speaking session at the OET Study Buddy, Optional International Network. My name is Olayinka Aremu. I'm your study buddy. Thank you for having me. So, continuation from our speaking classes. Today, I'll start with warm-up questions. I'm going to be asking these warm-up questions because I want to have a baseline of your speaking skills. You understand how you are able to communicate about these simple things. So in the OET exam for the speaking part, the examiner or your interlocutor, that's what they call interlocutor, which is like your examiner, will be asking you will ask you some general questions. These general questions, they will not be scored. They are not scoring it. So it's not part of the exam, but it's just basically like a warm-up question. You want to see how you are able to, relate and communicate with somebody. So the same way I'm going to be asking you that question, okay, as you can see from the list here. So I'm going to ask and put Adriana there to start. So can you tell me a little about your study background, about your career background, your academic background? So tell me a little about your study background. What have you done? Which school did you go? Where are you at the moment in your study? So relax, just express yourself the way you can. Don't mind either you're speaking the right English or not. I just want you to pour out just the way you are. All right, go ahead, Adriana. Tell me a little about your study, about where you were, like how your study, what have you been doing? What school did you attend before? Tell me the step-by-step of your study. Go ahead.
Okay, I made the high school.
Okay.
And nursing school after that. And I think like that's it.
Okay, so you went to high school, what year?
I finished in 95.
1995, high school. Where was that?
Where? In Romania.
Where?
In Romania.
Okay, so what school? Yeah, what school? What's the name of the school?
I don't know.
What was the name of your high school?
It's like high school number 2.
Okay, that's the way it's called. Okay, I understand.
Yeah.
So that was in 1995, right?
Yeah.
Nice. So after then, you went to nursing school?
No, the nursing school I done in like 2017, and I finished in 2019.
So was it
2020? 2020, sorry.
2020.
Yeah.
Okay, so between 1995 and 2017, so what were you doing?
I worked in different places.
Okay.
I get married.
Okay.
Children.
Okay, so you went back to school, to nursing school at 2017.
Yeah.
And you finished at 2020.
2020.
Okay, and since 2020, what have you been doing?
I worked in different places, like in policeman.
Okay.
in fashion.
Fashion.
Sorry, in fashion. Yeah, I think like that, like this.
And okay.
Yeah.
So
and then I came here in Ireland.
And in Ireland, and you've been working as what in Ireland?
Sorry?
What have you been doing in Ireland?
I start to work in nursing home.
As what?
Healthcare.
Healthcare assistant.
Healthcare assistant, yeah.
Okay, all right. So very good. Thank you so much, Adriana. Thank you. So what I did was to help you give a timeline, put time. So when somebody asks you, tell me about your study. So you say, yes, of course you have to introduce yourself. My name is Adriana. Yeah. And I started schooling, or I started studying in the year, when did you start studying? After your primary school. So you started high school at 1995, right? Or you finished high school at 95?
I finished.
Yeah, you finished high school 95. And after then, so you have to connect everything, it's connecting everything together. So how do you use them? Is you use what they call connective words. So I finished high school 1995, after which, so you see, after which is like following that. So you can say following that, I went to nursing school in the year 2017, and I finished 2020. So that's a way to align everything together. You finished 2020, and now you're working as healthcare assistant. So it's just a way to know where you have been and where you are. That's just very simple. But the way you say it really matters. So you need to be able to use words to join your words together.
Yeah.
You understand? So we will. I think I shared some words that you can use to connect your different words together. I'll share it again, and you can print it. So Bidita, I'm not going to ask you that same question, but I will ask you the next one. In this way, I will say, can you tell me a little bit about your job?
So I work as a healthcare assistant in a nursing home. I love my job. It's kind of a routine job because we're having a routine every day, the same routine. I work with all elderly people with dementia.
Wow. Okay. That's good. That, like I said, is just a bit, and that's very brilliant, saying where you work and what kind of, and it's good you said, I love my job. So it's you saying a bit about your job. You are saying things about your job that you like, and like you said, it's the routine. So you do routine. So when somebody says, can you tell me a bit about something? So you have to mention what that thing is. So your job is, I'm working as a healthcare assistant, and you have to say what you like about the job, maybe how long you have been in the job. I've been in the job for 2 years, for 3 years, for 5 years, things like that. And so it was very simple and straightforward. That's a good one. Okay, so let's go to another one. Where do you see yourself in 3 to 5 years' time, Adriana?
Yeah, I hope that I will be a nurse.
In Ireland?
In Ireland, of course.
Yeah, because you are a nurse, right? You are a nurse in your country, yeah. Okay.
Yeah.
All right. Okay. So that's another tricky question. It looked very simple to answer. Yes, I will be a nurse. but you rather say in. So if somebody asks, where do you see yourself in 3 to 5 years time? So you start with, in 3 to 5 years time, I hope that I will be a nurse. So you have to start with the last sentence, you know, in 3 to 5 years time, I hope I will be a nurse. So not just I will be a nurse, I hope I will be a nurse. So that is not a complete sentence. A complete sentence is, in 3 to 5 years time, I hope I will be a nurse. You understand? So if tell me a little bit about your job. I work as a carer and things like that. Like, it's just, it doesn't really express what you want to say. So you can say, yes, to tell you a little bit about my job, I work as a carer. So always introduce what you want to talk about. You know, so always say something like, I want to talk about my job. You're asking me about to talk my job. I work as a carer. So it's good you make a full sentence as much as possible. You don't want to talk too much, but make a full sentence. A full sentence will start with, for instance, like this one, in 3 to 5 years time, I hope to be a nurse. So if you say, I hope to be a nurse, nobody understands what you're trying to say. Yes, anybody hope to be a nurse, but in what sense? So in 3 to 5 years time, I hope to be a nurse. Is that okay?
Yeah.
Do you understand what I'm trying to explain? Okay, so let me take one more question there for these warm-up questions. I'll send it to you too. I think it's on the folder, but I'll send it to the group so you can just practice it on your own. While you're practicing it, this is, like I said, this is not the main OET speaking exam. This is just some warm-up questions that your examiner can ask you, you know, to see how you can communicate, how you can flow well with people. Let me ask you, what other interests do you have professionally, Brigitta? What other interests do you have professionally?
That's referring only for the healthcare section or something else?
Something else.
Something else is that I like gardening, yeah.
Gardening, yeah.
Gardening, and but I do it more for pleasure. It's not the professional level.
Okay, but you have interest in it, so that's simple as well. I know these are some personal questions, but the questions are just to see how you express yourself. It's not basically like somebody, I want to know what you're doing, you know what I mean? So it's just to see how you express yourself. So again, about that was good. Saying, so how do you start that kind of response? What other interests do you have professionally? So you can say that professionally, because the question says, do you have professionally other interests? So you can start with professionally. At the moment, I'm working as a healthcare and I love my job, but other interests that I have is gardening. So start with professionally, other interests that I have is gardening. So if we just say other interests I have is gardening, it's not really specific to professionally. So start with professionally, other interests that I have is gardening. You know, you can now go on and say, although you are just doing it for leisure now, but you can be professional about it if you want, you know. So that's just a way to communicate and express yourself. Okay, so I'm going to leave this slide now. Like I said, I'll send this to you, and it's just you trying to communicate in English. Don't be head back like, okay, what does that mean? I understand if you don't understand maybe some words, you can try to find the meaning. This is the preparation time, so you can always try to find the meaning of words that you come across every day. Once you have the meaning, write it down somewhere, revise it, and then that is it. It sticks to you. So when you see it in another time, you already know what it means. Do you understand?
Yeah.
So if somebody asks you, what plans do you have for short-term or long-term future?
What plans do you have?
Short-term or long-term future? What plans do you have for long-term or short-term future? So I'm going to answer this. I'm going to let you answer that. So if maybe you don't know what short-term is, you don't understand, you feel like, okay, what does short-term means? Since you are still practicing, you might want to, just check short-term. Short-term means within a very short period. What do you want to achieve? What plans do you have within a very long-term is maybe after 5 years and more. What plans do you have? Oh, I want to travel across the world, with my children and things like that. That could be long-term. That's a long time for me. I want to travel all over the world and, with my family and just go around the world. But at the moment, what's your short-term goal? A short-term goal that you can have is maybe within 1 year, I want to study for OET and pass my OET exam so that I can be registered with nursing. You understand? So that's like a plan that you have for short term. So when they ask you this question, they just expect you to tell them what you want to do in the nearest future, like in very short term, within the nearest time. Maybe 1 month, 2 months, 3 months, 1 year. That's short term. All right, so let me leave this now and go to a particular model. Can you see this?
Yeah.
So if you look at this card, you have one for the patient and you have another one for the nurse. So this is the one that you will be given in the exam day for the speaking. You'll be given this and your patient or your examiner will have the patient's own. But for practice purpose, you have access to the two. The reason why you have access to both is that you will know what your patient wants to say or what the question your patient wants to ask you. So it helps you to also prepare ahead, So let's read this. So Bijita, can you read this?
An 18-year-old female with undiagnosed anorexia nervosa has presented to your emergency department with an abnormal heart rate caused by her poor nutritional status. Cardiac treatment has stabilized her heart, but she is still currently receiving a potassium infusion via a drip to prevent further such problems. Other than when she wants you to explain treatment to her, she is defensive and angry, to communicate with and in denial that she has any kind of eating disorder or mental health issues.
Okay. So thank you so much for that. That is describing the scenario. So you have an understanding of what you are to talk about. Now, if you look at that, I'm going to be on the line. I want you to underline some words. Give me 1 second and just for my kids. Is one of them disturbing me here? Okay, sorry, I'm back. So, an 18-year-old female. So I'll put in mind, this is 18-year-old, not an adult, not somebody, you know, adult, but like still young, is a female, undiagnosed. Undiagnosed. What does undiagnosed mean?
It's not diagnosed yet.
Adriana, do you understand that? So when you see undiagnosed,
What do I have to see?
undiagnosed, yeah.
Undiagnosed. Undiagnosed.
Yeah. You know what that means?
Diagnosticato. Sorry, I don't understand what I have to say.
Others, I want to know if you understand this word, undiagnosed.
Yes.
Okay, what does that mean? Tell me what it means. It's not diagnosed. Just say it as you want to say it.
I don't know how.
No, just say, that is it, I just said not diagnosed. Undiagnosed means it's not diagnosed.
Yeah, it's not undiagnosed. No,
Undiagnosed is,
undiagnosed.
yeah, that means it's not diagnosed.
It's not, yes.
That's what I just wanted to say it. I just wanted to say that it's not diagnosed.
It's not diagnosed. Okay.
All right, now, anorexia nervosa.
What?
That's anorexia nervosa. Do you remember that? Have you come across that in nursing?
Yeah, I think so.
Okay.
Yeah, no. Yeah, but in the nursing home, you said no?
No, I'm saying in nursing, generally in your nursing, when you were in nursing school and all that, did you come across that word?
Okay, yes.
So what does it mean?
When a person, if she wants to lose weight, and if she's eating something, she's throwing out. Oh, no, not throwing. Oh,
Adriana, face me, focus on me, not on Brigitta. Face me. Say anything you want to say. This is the opportunity to say. I'm not judging you. I'm not going to criticize. It's just speak it out the way. If you want to speak your dialect, if it comes to your mouth, say it. Then correct yourself. Yeah. Okay. Yeah, you're very right. Somebody wants to lose weight, but is doing something so that it will not gain weight, right?
Yeah.
Sometimes after eating, they will throw up, put something in their mouth to throw up.
Yes.
You know, things like that, or they might go not eating, you know, just because they want, you know, intentionally. And it's a mental health disorder. It's a psychological disorder.
Psychological, yeah.
Yeah, okay. So the reason why I'm saying this, you have to understand the keywords in the test. If you don't understand the keywords in the test, you will not be able to, talk about it properly. You'll not be able to address the task. Now, this 18-year-old female with undiagnosed anorexia nervosa has presented to your emergency department with an abnormal heart rhythm. You understand that, right, Adriana?
Yeah.
So heart rhythm is abnormal, caused by our poor nutritional status. Of course, she's not eating well. So now, cardiac treatment has stabilized her heart, but she's currently receiving a potassium infusion via a drip to prevent further such problems. Okay, say something.
Via
Via
a drip.
a drip.
I don't know what this means.
Okay, so via means through. Via is a word that is used when you say through something. So she's getting potassium infusion through a drip. A drip. So potassium infusion, potassium infusion is like a bag, maybe in the bag.
Yeah.
So she's getting the potassium infusion through a drip. They're using a drip to give her potassium infusion. IV drip. The IV drip?
Yes.
Yeah. So that is what they are using. So via, VIA, write it down in your book. VIA is another word for true. It's just a synonym. Via, true. Yeah, I'll type that in the chat box now, so you see.
True.
Print. Okay. Good.
Yeah.
Can you see that?
Yeah.
So anywhere you see via, it means true. Or
okay.
Another way you use via is you can type it in Google Dictionary and get different ways there how via is being used. So you see, because you saw this, you saw a new word, and you will learn that new word, which is via. You've learned via today, So via a drip, through a drip, to prevent further such problems. So other than when she wants to explain treatment to her, when she wants you to explain treatment to her, she's defensive and angry to communicate with. And in denial, do you understand in denial?
Yeah.
That she has any kind of eating disorder or mental health issues. So now they say, look at other than when. What do you understand as other than when? Other than when she wants you to explain treatment to her. So when they use the word other than to begin a sentence, it means they're trying to say apart from. So I'll say you should write that down again. Other than. It also means apart from. So remove other than and put apart from when she wants you to explain treatment to her. She is also defensive, angry to communicate with. So that means, number one, she wants you to explain the treatment to her, right? But she is defensive and angry to communicate with. So they put the word other than there just for you to know that apart from, so write that down and note it. So look for other ways where they can use other than, just for your own learning. So apart from when she wants you to explain the treatment to her. So now she wants you to explain the treatment to her, but she is defensive and angry to communicate with. Apart from, you can also say besides. So besides, you know, that's another way to use other than.
Okay.
Now, they have explained the situation. Now, this is your task. You see task? That means what they want you to do. The first task they say reassuringly. What does that word mean? Reassure. What does it mean? Reassuringly. What does it mean to reassure? Brigitta?
To assure her, like to make her sure that you answer. I don't know how to translate the word.
Neither, but I know the answer in Romanian in my head, but I don't know how to tell you in English to.
Okay. Any simple clue, give me, just say it in any simple way. Reassure.
Like to make her, to calm her.
Yes.
Yeah.
Calm.
No.
Yeah. Okay, yeah. To calm her down, or to, now for you to say reassure, look at all means like again. You understand? Reassure. It's like saying repeat. You understand? So reassure. Reassure her. There is the word called assure. Assurance. So when you say, I have assurance, that means I have confidence. So when I say reassure, that means give her some confidence. You know, give her some confidence. So write this word down again and find out the meaning in simplest English. Reassure, because you need this more in your speaking. You come across this more. Even in nursing generally, we reassure our patients, right? So we reassure patients that maybe they're anxious. You are trying to make them calm down, to settle them, to give them more confidence, right? That is what reassure means. So now this one says reassuringly. The ly there just means that you should reassure her. Okay, so reassure her by answering her anxious questions. What is anxious?
Question.
What does anxious mean? Brigitta?
It's like anxiety, but it's anxious.
Yeah, so that means she has some questions that she has anxiety about. There are some questions that she's, she's concerned about. Okay, so let me put it out. Anxious concerns. When you are concerned about something, you'll be anxious about something. It's like, I'm concerned that maybe the doctor is going to diagnose me of COVID. So I'm anxious because I don't know what will happen. I don't know what the doctor will say, So she has some anxious question about the intravenous drip. What is the intravenous drip we are talking about here?
The potassium infusion, no?
Yeah. So that's the infusion, the potassium infusion. So she's anxious about that infusion being given to stabilize her electrolytes. So they want you to reassure her about that. No, first of all, what you need to know is you want to reassure somebody about intravenous drip being given to stabilize the electrolyte. What are you going to say? Let me start from Bijita. I'll allow Adriana to think. So,
Okay.
what do you want to say to this 18-year-old female that is anxious?
I'll explain the procedure, but I would say it's not something painful. It'll be fast. You'll be monetized. It's something that you need.
Mm-hmm. Okay. So what other thing, Adriana? Okay, forget about intravenous drip. I am in front of you. I'm anxious about maybe losing my dog. My dog is sick. I don't have a dog anyways, but just imagine I have a dog and I'm anxious, so I don't know if he's going to die. How are you going to reassure me, Adriana?
So I can tell her that her dog, it will be fine. And maybe I can tell her that I have a dog too. So
No, don't tell her. Tell me. It's me. To talk to me. It's my dog.
Okay. So I have a dog too, and probably I will be the same, anxious about this, about my dog. And I know how she feels.
You know how I feel.
Yeah, I know how you feel.
Okay.
And it will be fine. I don't know.
Okay, yeah, that's okay. That's okay. So that's a good one. First of all, when you want to reassure somebody, you need to put yourself in that person's position, right? You need to, other things you have to do is to ask the person some questions. You know, you can ask how they feel.
What is the dog name, maybe?
Yeah, you can ask them to, to say something. The more they talk, the more reassured, the more they settle, so you can ask, how do you feel about your dog? And you ask them to tell you, to express their mind about how they feel. Oh, I feel terrible and all that. And you can say, oh, I'm sorry about that. So it is what they tell you that you respond to. But if you don't ask, they will not be able to tell you, So it's like ask, receive, and, ask again, receive, talk about it. So you ask, you receive, then you talk about whatever you have been given.
Yeah.
You understand? So now let's come back to intravenous. I don't have a dog, so thank you for your reassurance. Okay, so this is somebody that, so many people don't like injection or any drip. So what will you say? This person is anxious about a drip that she's been given.
Is anxious about?
The drip.
Oh.
Yeah. So Adriana, how are you going to reassure her? Bijita, you want to try again?
Okay. Okay. I completely understand your feelings. I can understand you're scared. That is,
Yeah,
scared.
I can understand you're scared. Yeah.
You're scared, but for the moment, it's the best option for you. You need the drip just to stabilize the electrolytes.
Right, yeah. Okay, can you ask her, how is she feeling? What exactly are her concerns? Because if I'm anxious, you don't know exactly why I'm anxious, even though it's about the intravenous drip. What exactly about the drip am I anxious about? So you need to ask me. So how will you ask her that, Adriana? Yeah, how will you ask me how I feel about the intravenous drip? What exactly is my concern about the intravenous drip? I just said it to you. I just want you to repeat what I said. Okay, Adriana? Now ask me, how do you feel, or what are your concerns about the electrolytes, intravenous drip? What exactly are your concerns about the intravenous drip?
How are you feeling about
The drip is there, intravenous.
the drip?
Yeah. Intravenous.
Intravenous drip.
Yeah. Okay, I'm anxious. Now, I just imagine that your speaking role is like you acting. You watch movies, right?
Yeah.
So you are going to be acting, act that role. So as you're acting, imagine that I'm shaking. I'm anxious. Oh no, I don't want this drip. 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 So reassure me, I'm being anxious. Adriana, I don't want this drip.
Why are you anxious about the drip?
I'm anxious because I'm anxious. I don't know. I don't know if it's going to harm me. I'm anxious.
You're scared about the needles?
Yeah, yeah. Is it going to be painful?
Needles. Just one moment. Needles? Okay. Sorry, I didn't know the word. Sorry.
You said needles, yeah?
Yeah, but I didn't know. Okay. Okay. So I have to learn so many words. So it's.
So, yeah, I'm going to pause there for Adriana. How many words do you learn per day?
Sorry? How many
words do you learn per day?
Oh, not so many.
Okay. So we're going to start that. You need to have a plan. You need to have a plan.
Plan.
Yeah. So this is outside OET, but for your English, if you want to improve your English language skill, especially for your words,
yeah,
have a plan. Give yourself a plan. I'm going to learn 10 new words every day.
Okay.
10 new words. No, you can decide to do more than that, you know. I'm only telling you, you know yourself. So
and me, I have to choose the words, or
so yes, you will be reading. That is what is important for you, to read books that are in English, you know. So when you come across, as you read, you will come across new words and you're going to learn them. So give yourself a task of, I want to learn 10, 20, depends, you know yourself. No matter what happens, no matter how busy I am, even if I go to work, I want to learn 10 words every day.
Yeah.
10 new words. That means you will have a writing pad with you every time. You know? Every time. So, and that means you're going to be reading magazines, Don't be scared of picking up an English magazine anywhere. Pick up any letter, anything at work that you find written in English. You know, pick it, read it. And when you're reading, you come across the word you don't know. Write it down. At your free time, go to your dictionary, not Google Translate. Go to dictionary, type the word in, and it will break it down for you.
Yeah.
That's how to learn. Especially medical books, you know, nursing related, health related books. So that's how you improve your you know, vocabulary in English. I sent you a link, you know, for there's this particular lady learning with, is it Anne? English with Anne. So there are other resources as well. As I come across any, I'll be sharing it on the group. You know, we just continue to learn. Don't give up on yourself. Okay?
Yeah.
So every day, imagine you want to build a house. They will start with one brick, right? A house. The builders will start with one block, right? A block, a brick, like for house.
Yeah.
They'll start with a block, and then one block over another block, over another block, till it becomes a big house.
Yeah.
So that's the way English is.
So it's
Brick.
Yeah, block or brick.
Okay.
What do you call it in Romania?
Cărămidă.
Cărămidă.
Brick? Brick, yeah. Block.
Block or brick.
Okay.
Capa?
Yeah. Cărămidă.
Okay. So that is that. That's just the by the way. So I'm just trying to see how to help Adriana here. So first of all, like you saw the way I'm acting, the same way, you know, your interlocutor might not be acting that way, but they want you to picture in your head, this is what is happening. How are you going to respond? So somebody is anxious. So think of how will an anxious person be? Oh, you know, just imagine one of your residents, like, you know, really anxious, they wouldn't want to fall. And you say, oh, why are you? Can you tell me? First of all, before you ask them question, you need to calm them down. Okay? So you need to say, can you calm down? Please calm down and talk to me. I'll listen to you. I'm here to help you. You know, something like I'm here to help you. I'll relax. Can you tell me exactly why you are anxious about the drip? Okay, maybe say, I think I'm allergic to it, or I don't think I will have reaction to it. You know, the person can say anything. So after the person have said why they are anxious, then you now say, give it your own information. Well, I understand your worries. I understand your concern. I can really understand why you are anxious, but can I tell you that the intravenous drip will not do you any harm? Instead, it's going to help to stabilize your electrolytes and make you feel better. So, you know, it's just you talking, but it's how you go about it. You can't just say, no, electrolytes is good for you, don't be anxious. So you have to have a communication pattern. You have to say, oh, I'm sorry you're feeling this way. I understand your worries, I understand your concern. But just to let you know, the intravenous drip, which is potassium, so let them know potassium infusion will help to stabilize your electrolyte. It's important for your electrolytes to be normal, because if your electrolyte is not normal, is not stabilized, you can get sick. You can have heart problem, which is, you know, some of the things that I've said in the test. So you can have heart problems, you can get sick. So we're giving you the electrolytes through your vein, so you can sleep right. Intravenous means through the vein. So giving you through the vein so that it can work quickly. You know, it can work quickly so that you will be well. Simple. So that's how to reassure. So just say, you'll be all right, and I'll make sure that you are all right. I'll be there. If you need any help, let me know. Okay. Again, I think I have a list of how to reassure, what and what to say to reassure, what and what to say to encourage. I have a list. Did I send that?
It was in the no, but on the course you mentioned a few.
Yeah, I mentioned a few. I'll send you the document as well. So to help you to know what to say in certain circumstances. Now, we finishing up. Let's go to the next one. Now, I say tactfully. I think that's a new word for Adriana. Bidita, do you know the meaning? Tactfully.
Full of tact.
Yeah. How? Tactfully. Systematically, it means like you want to use the system, just gradually, tactfully ask her about eating habits and food intake. Remember that she's in denial that she has any kind of eating disorder. So when they say tactfully, Adriana, have you come across that word before?
I don't know.
Yeah. So a tact means like step, is like a strategy. So they want you to strategically, that's another word for it, using style, like in style. You don't want to ask straightforward that what's your eating habits? Or you don't want to say, do you eat at all? She won't tell you anything, So they want you to use style by style, in a way to get the information. That is tactfully. Tactfully means strategically, using systematically, like just use a system, use an approach, use a style to ask her about her eating habits and food intake. Emphasizing your therapeutic aims. Now, emphasizing, do you know the meaning? Emphasize. Adriana? That's another list for you. Emphasize. So emphasize means that you focus. You focus on, we said, emphasizing your therapeutic aims for asking these questions. Now, therapeutic means treatment.
Yeah.
It means healing, right? It means, treatment and healing. So you are trying to focus more on the benefits of you asking the question. So I'm not just asking you this question for asking sake. I'm asking because, you want to relate it to the health. You want to relate it to her health. For instance, how can you ask about eating habits? Adriana? Brigitta?
Okay, would you mind if I ask you about your eating habits? Can you tell me more about your food intake?
Okay, so that is more broad. Thank you for that. That is just it. But if you tell me eating habits, I'll say, what do you mean eating habits? So that's why they said tactfully. You need to break it down. How you can ask that is, can you tell me how many times do you eat in a day? That is an eating habits, right?
Mm-hmm.
So you ask me, can you tell me how many times you eat in a day?
No, how she said, eating a bit.
Eating habits.
Habit. Eating.
Habits. Yeah.
Eating habits.
Yeah. Your habits, your behavior. Habit means behavior. So a part of eating behavior or eating habits is how many times. So we are talking about habits. Frequency, that is how many times, right? Then volume. Think of how much does the person eat. Any preference, maybe does he prefer vegetarian diet to, what's the preference? Any dislike? So you see, in that one question, I have simplified it into 4 simpler questions. So I can ask her, how many times do you eat in a day? Now, look at the other part. They said, emphasizing your therapeutic aims for asking this question. So what would be the benefit of me asking how many times? I can say, oh, how many times, if you don't mind, can I ask you, how many times do you eat in a day? So that it will help me to understand how much nutrients you have in your body. Do you understand? So I have given a reason why I'm asking the question. So I'm not just asking how many times do you eat in a day. I can say, fuck off, why do you care? She can, somebody that she's angry. So you need to be, pay attention that this person is angry. I need to speak in such a way not to get her angry the more. And that is why you have to be tactic about it. You have to, systematically, you have to use wisdom, okay? Now, you want to ask, how many times do we eat a day? So we don't know her name, just say, if you don't mind, I'm very sorry. Like, if you don't mind, I just want to know so that I can help you, plan your diet and how to help you so that you have enough nutrients and you don't get sick. Can you tell me how many times you eat a day? Okay, well, I eat only once. That's a response. All right, thank you so much for that. Don't say, wow, only once. She'll just slap you. She's angry, So you said, okay, thank you so much for telling me that you eat only once. All right, do you prefer any particular food? Well, I don't have any, no, I don't like any. You have gotten your answer. Or maybe you say, well, I like rice. Yeah, just rice. Okay, oh, that's good. You like rice. That's good. I also love rice. Just say that. It's not like just so you keep the communication flowing, All right, thank you again. Do you have any dislike, anything that you dislike, that you don't like? Well, I ate bacon. Yeah, thank you. Thank you for telling me that you ate bacon. Okay, but can I ask, you said you like rice. Like, how much do you take at a time? Like, just tell me if it's a small, medium, or big that you take at a time. Well, I just take small. Okay, thank you so much. So if I understand you well, you just told me that you eat only once a day and you like rice and you don't like bacon and you only eat rice, small portion at once. Is that correct? Yes. Thank you so much for telling me that. Thank you. I know asking you, I just want to help you, to know how to help you have a good, nutritional diet. So you have answered that question about you asking about our eating habits and food intake by asking 4 questions. So if you notice what I did there, I asked the question, I didn't put everything together. So don't ask too many questions at once. So split them one after the other. Break it into simple forms. So here it says, ask her about eating habit and food intake. But I have been able to break it down into 4 simpler forms. and I ask it separately, one after the other. In between each question, I am saying, thank you for telling me, and then thank you for telling me that. I really understand. I appreciate you for telling me that. Then I ask the second question and I say, thank you for telling me that. I do appreciate that. If you don't mind, can I ask how, you go to the next one and to the next one. And after you have finished asking your question, then you go ahead and say, thank you so much for telling me all that. Now, clarify. In speaking, it's important that whatever you say to your patient or to the examiner, or whatever the examiner tells you, you clarify, at the end. So I've told you that 4 things, and I say, thank you so much for telling me. Can I just confirm everything you have said? You just told me that, I mentioned it's this, and this. Is that correct? Or am I missing anything? So what you have done is you have confirmed, you are confirming the information, because anything could happen, this is important for healthcare. This is an healthcare communication, because any mistake in, information can affect the life of the patient. So apart from this teaching you English, is also teaching you healthcare communication, the importance of, clarifying information in healthcare. So that is how to answer that question. And you go to the next one. Thank you so much. Now, one other thing I want to talk to you about is to advise you. They said, advise her that a mental health doctor will come to see her soon. And when she becomes angry about having to see a doctor for crazy people, try to persuade her of the importance of dealing with her mental health, hitting issues to prevent such life-threatening hospital admissions. Now, we've been talking so long. I'm going to leave that one for you as an assignment, that last part. Okay? I need you to read it, understand it, and think of how you're going to answer her. Remember that you have this first part to know what she will say. Okay? But in the exam, in the real exam, you will not have this patient card. But just for you to practice, go through what the patient is saying here. Look at the first one, the second one, and then the third one. So I want the two of you, Adriana and Bridita, to practice this card in the next 30 minutes. I'm going to log out, okay? So you have, as part of your homework or your classwork, your, what will I call it now? Self-directed learning. So you're going to practice this on your own. Record it on the phone, the conversation you have between yourself. I want Adriana to be the patient and Bridita the nurse. And after that, you will, swap again. Adriana will be the nurse and Bridita will be the patient. Is that okay?
Yep.
All right. Any questions so far? The way Adriana does her face is funny. Like anything, whatever.
No.
It's okay. So before I go, I just want you to know that this will take, the two of you have been able to establish that you have different learning space. You're in, like, your English background is different. So, and that's why most of the time I'm focusing on Adriana, because Bridita has like a middle level, so to say.
I told you.
Yeah, she has a middle level, so to say, and like that. So we will just find a balance, you understand? Adriana, you don't have to be worried. I know you feel like, oh, am I sure I'm going to know this?
Yes, yes.
Yeah, I don't know if I'll be able to or not. But just think of,
I am like that.
I know, just think of, what about other people from Romania like me that speak good English? They don't have two heads.
2 heads.
They don't have, do they have two heads? Head. Yeah, their head.
No.
They don't have two heads. Yeah, they are the same. They are like you.
Oh, yeah.
Yeah, when I say two heads, that's my culture way of saying they are the same. You are the same. You are Romania. They are just like you. They are not special. I am an immigrant. You understand? I'm not like, even though Nigeria, our official language is English, but I have my local language too. I speak my local language. My children speak our local, like we speak our local language, but it is your mindset. So have it at the back of your mind. And I'm also saying to Ankuta, she's going to watch this video, that have it at the back of your mind that I will, do this well. I will know this. I'll be good at it. But then it doesn't come in a day. It comes, it's a process. And you need to appreciate the process. You need to be patient with the process. So patience, you know what patience is? Yeah, patience is very important in this process. Part of patience is you being proud of every moment that you learn something new. Be proud of that moment. Don't condemn yourself. Don't judge yourself. Don't, look down on yourself like, oh my God. You have learned how many words today? Just within this 1 hour, you have learned like 4 or 5 new words. You are better off than you were.
Yeah.
Okay, so go again, think of it again tomorrow. I'm going to learn 10 new words. I'll be better off by the next day. So you take it like that and communicate, no matter how stupid it might sound. Start with your friends. Communicate in English. Honestly, I know I'm not there with you. When you want to speak with data, speak English. That's how it starts. Speak English. If there is a word that you are finding difficult at that time, I know it's not every time that you have to, carry dictionary. Maybe you are speaking with Brigitta and you lost the word. You want to say something. You have opportunity, that freedom to say, what is this thing in English? At that point in time. And when she tells you the meaning in English, repeat it and say what you want to say now in English.
Mm.
So promise yourself, not me, that you speak English even to your Romania friends.
Yeah, promise.
Yeah, okay, so it helped you. Even if they are speaking Romania to you, you respond to them in English, no matter how stupid.
I will speak with my husband in English. He doesn't know anything. He doesn't understand, so it will be very funny.
Anyway, yeah, you won't know if you are saying the wrong thing anyways. All right, ladies. Okay, I leave you to do your practice. You have this book, right?
Okay, yeah.
And that is card number 25. So you know.
You sent all this on WhatsApp, or no?
Yeah, I'll send it again now.
Yeah, but I think I have it. So.
And I have a question. Did you send me the first meeting?
I don't think I did, but what I do is I'll have to download it and upload it on the YouTube, and then I'll send it to you.
Okay,
I'll do
please.
that now. Yeah.
Thank you.
All right, ladies. Thank you. It's been a long day.
Thank you.
Who is working tomorrow?
Me,
Me.
me, of course.
And you too?
No.
Okay. See ya.
Not
Bye.
one.
Yeah,
Bye.
bye.